President Biden has COVID-19. Variants of the virus are spreading quickly, and the World Health Organization is considering whether or not to declare monkeypox a global crisis. So here to give us some answers on what's going on with these outbreaks is Dr. Anthony Fauci. And you likely know, but just in case you don't, he is the chief medical advisor to the president and the director of the National Institute of Allergy and Infectious Diseases. Doctor, thank you so much for joining us right now. So, let's start with the news of the last 24 hours, which is that the president has contracted the virus. Have you spoken to the president, and how's he doing?
I have not spoken directly to the president, but I spoke last night late with Dr. Kevin O'Connor, who is the physician to the president, to get an update on how the president was doing.
Dr. Fauci, it's Vlad. I know the president has gotten 4 COVID vaccine shots. He's taking Paxlovid. The science that you have shared and others have shared with us is, of course, there is concern for anybody who's older than 50 and has some pre-existing conditions. But are you at all concerned for the president of the United States? I mean, Queen Elizabeth II had COVID-19, and she's way older than President Biden.
So what I can tell you is the medical and scientific facts. The president is generally a healthy person. He has been vaccinated and boosted twice, and he is now on a very good drug that has a very good track record of preventing people from progressing to just symptomatic disease into severe disease requiring hospitalization. All of those factors make us feel reasonably confident that he will do quite well. As of last night, when I got a report from his physician, he was doing fine. He has some mild symptomatology, which you would absolutely expect someone to have, where you have a bit fatigue, you have some runny nose, you have a few aches and things like that. That's absolutely natural for the infection. The fact that he is on Paxlovid, I fully expect that he will do very well. I had a similar experience myself, as you might recall, where I was vaccinated, doubly boosted, went on Paxlovid, and literally within a very short period of time, my symptoms resolved. That's not a guarantee for everyone, but the chances are highly likely that he will do well. Right now, he's feeling well enough to perform duties from the White House, contacting people he needs to contact. So right now, he's doing well and is quite stable as of last night at 10 o'clock.
So, Dr. Fauci, we don't know what sort of version of this virus the president has, but we do know that BA4, BA5, they become the dominant strain in this country. I've heard of other variants in other parts of the world. What do we need to do to slow down the development of new variants? Because it seems like, every few months we hear about another one.
Well, that's a very good question, and it is the biggest argument possible for getting as many people, not only in our own country, but throughout the world, vaccinated and boosted. And the simple reason is viruses become new variants when they get the opportunity to mutate. And when you have a high level of viral dynamics, where you have a lot of people, mostly unvaccinated, who are spreading infection back and forth, what you're doing is you're giving the virus the opportunity to mutate. And when you give it the opportunity to mutate, you give it ample opportunity to evolve into a new variant. And that's the reason why we say the lower level of viral dynamic, not only in this country, but throughout the world, the less chance that you will have to get a new variant that could be troublesome, which is the reason why I keep saying, and my colleagues keep saying, we've done very well. We've done a lot with regard to vaccinations and testing and drugs and antivirals since January of 2021, but we still only have 67% of our total population vaccinated, and only about a half of them have gotten boosted. And also, since we know that the immunity, either from infection or from vaccine, over a period of time wanes. So if someone has not gotten a boost in the calendar year 2022, they need to get a boost, because we know that after several months, what you have is a waning of immunity. So there are a lot of things we can do. We've done a lot, but if we want to prevent new variants from occurring, we've got to get more people vaccinated and protected to slow down the dynamics of the virus.
So, Dr. Fauci, I'm one of those unicorns. I have not yet been infected with COVID-19, and I have 4 vaccines. And now, because of my confidence in those vaccines, in the NIH guidelines and the CDC guidelines to wear a mask indoors, et cetera, I feel pretty confident that if I were to be infected, that I would hopefully be okay. But the reason I'm still worried about it is because of long COVID. And you mentioned your own COVID-19 infection. Have you noticed anything sort of strange since you've recovered from COVID-19? And more specifically, I guess, what is the NIH doing to sort of research these long COVID symptoms that vary? There are like 50 different symptoms that some people have claimed that they've gotten. How do we ever get around that in the future?
Okay, 2 questions, good questions. I'll take them one at a time. I was fortunate and am fortunate in that I recovered completely. And right now, a few weeks out from my bout with COVID, I feel essentially normal. I don't have any residual effects of fatigue or any of the other things. That doesn't mean that other people might not get it, because as you said correctly, varying percentages of people, anywhere from 5 to up to 30% or more people, have lingering symptomatology, which you correctly described as very heterogeneous. I mean, ranging from, rather severe fatigue upon exercise, which normally would not cause fatigue, sleep disturbances, inability to concentrate or focus. What the NIH, together with the CDC and other organizations, the Assistant Secretary for Health and others, are doing an awful lot. For example, the NIH has put in, with the generosity of the administration and the Congress, $1.15 billion to do a broad cohort study to find the answer to some of the questions that you asked, because it's such a perplexing syndrome that we don't know what the underlying pathogenesis. And by pathogenesis, I mean, we don't know what the mechanism of these disturbing symptoms are. Nothing comes out and is obvious to you that you could see on an X-ray or that you could see with a lab test. So we have a lot of work to do with determining what the real true definition and boundaries of this syndrome is. And if we find out what the pathogenesis is, what we can do about it. So we are putting a major, major effort on trying to address a problem that is really an important problem.
Before we let you go, I want to ask you about sort of 2 other viruses that we've been hearing about in the news lately. Monkeypox, the monkeypox outbreak in this country. I know that you led the National Institute of Allergy and Infectious Diseases during the AIDS crisis. Initially, monkeypox was sort of, in this country, was kind of relegated to a particular community, but it's certainly gone beyond those boundaries now. What do you want people to know about the monkeypox virus?
Well, what we know about it is that we know what the etiologic agent is, which is very different from my experience in the early 80s with HIV, which we did not know we were dealing with. Number 2, we have diagnostics. Number 3, we have vaccines. And number 4, we have antivirals. The challenge now is to get those interventions in an expeditious manner to the people who need them. Now, obviously, this is a disease that's transmitted by close skin-to-skin contact. If you look at the epidemiology, it's heavily weighted at this time, though not exclusively, to men who have sex with men. So we've got to alert that community and the physicians who take care of them without inducing the terrible issue of stigma, because stigma is the enemy of public health. So you want to make sure we address this to the group that is predominantly involved and predominantly being afflicted, but at the same time, don't make it a source of stigmatization. So we've got to implement the interventions that we have, and that's the challenge ahead.
Dr. Fauci, before we let you go, let me ask you briefly about this confirmation in New York State of a new case of someone who's been infected with polio in an unvaccinated adult in Rockland County, just 30 miles outside of New York City. It's not unheard of. There have been instances in the past 20 or 30 years when 1 or 2 people have been infected with polio. But what should people
who hasn't traveled outside of the country recently?
So that's sort of what is interesting. Yeah. And I didn't understand, Dr. Fauci, the news reports had said that the person may have been infected by somebody who received an oral polio vaccine. To me, if you receive the vaccine, shouldn't you not
be able to infect anyone?
Anyone. Yeah.
Okay, and very good question because it is confusing. The reason we've stayed away from oral polio vaccines is when you want to massively distribute a vaccine to a population. But one of the components of the live oral polio is the type 2, which in fact is something that can spread to individuals. And one of the reasons why we see it is that it is likely the source of someone who was innocently vaccinated, but in which you have the type 2 that either in the stool or somehow got out and infected someone else. Because the vaccines now, since the type 2 is no longer a problem globally, they're not immune to the type 2. So we've got to be very careful now and vaccinate people not with the live vaccine that we have right now, but with the safer kill vaccine for those people who might have been exposed. It's something that we've seen before. We've seen an occasional outlying case of someone that's what we call a vaccine-related case of polio. And what you're talking about is that it has spread beyond that person. So we got to make sure we keep an eye on that and we do all the appropriate CDC-recommended guidelines of how to address that.
Dr. Anthony Fauci, always great to talk to you. Thank you for taking some time to spend with us. We appreciate it.
My pleasure. Good to be with you.